So I suppose I've always been around older people. My mum and dad were in their late 40s when they had me. I had older aunts and uncles. My grandparents were very, very elderly when I was a child. And then in later life, I cared for my mum and dad. My dad had Parkinson's and my mum had a brain tumour. So it was that lived experience that really has enabled me to understand the difference making a positive change to older people can make in their lives. My name is Sarah McLaughlin. I am the Executive Director for Health at Mid and East Antrim Agewell Partnership. The purpose of IMPACTAgewell is not only to improve outcomes for older people in their health and well-being, but also to help join together all the different partners in that health and well-being journey. So it could be the GP, could be the social work team, could be the community pharmacist, and could be the community team that we represent. So it's about joining all those people together, but also connecting the older person back into their community, to the assets in that community, so that they can understand when we step out of the support, they're in a better position to look after themselves and age well. So I have quite a varied journey because I went to university to study law and finished my law degree, and then decided that I was really interested in becoming a journalist. So went, trained as a journalist, and spent about 6 years working for a local TV company. But during that work, I came across lots of health and social care stories and lots of charity stories and community-based stories, which really fascinated me. And then I suppose because of the caring responsibilities that I had for my parents and the things I was coming across, I realised then that I wanted to retrain to work in health and social care. And then the bonus was that I got to work in the third sector as well.
IMPACTAgewell has already got a model which has been able to connect up social workers, GPs and pharmacists with community and voluntary resources. Working with Sarah and her team enabled us to understand what was it that's enabled them to bring together those different professional groups and also to develop the local community. Working with Sarah and her team, we've been able to draw out insights that we can then share across the rest of the UK. We've also been able to focus on other areas that IMPACTAgewell wanted to do better on as well. So for example, how do you work with different diverse communities in a local area and make sure that the services that you provide reflect their needs and aspirations as well?
My days can be very, very varied. It can be meetings, can be events, can be visits, and it's all about bringing the team together. So the team in Mid and East Antrim, Agewell, but also the team that work with us in our statutory partners as well. Whilst it is a tricky sector to work in, you're constantly looking for funding, you're constantly trying to manage budgets and retain staff. We get so much fulfilment in taking an older person from the beginning of their journey where they feel insecure and isolated to the end of a journey where they feel empowered and more connected to their community.